Welcome. This is an evaluation of Oncology Massage on self-reported symptom burden and well-being for breast cancer patients attending an Australian comprehensive cancer centre here at the Chris O'Brien Lifehouse in Sydney, Australia. Breast cancer is one of the most commonly diagnosed cancers in Australia. 55 Australians diagnosed every day, 20,000 Australians diagnosed each year. Since 1994, 5-year survival rates have improved from 76% to 91%. Increased incidence and improved survival rates have led patients to increasingly seek out support through treatment. Patients undergoing treatment have a high symptom burden which impacts their physical, mental, psychological and social well-being. Chris O'Brien Lifehouse has a strong focus on integrative oncology, including oncology massage, and supports evidence-based therapies. The core mission to treat the person, not just the disease. The aim is to evaluate the perceived benefits of oncology massage to those who've received a breast cancer diagnosis at any stage of disease or treatment. This is a retrospective evaluation of 228 individual breast cancer patients who received oncology massage at Chris O'Brien Lifehouse and completed PROMs. Oncology massage is an evidence-based therapy used at major cancer centres around the world. It adapts traditional massage techniques and protocols to allow for clinical considerations and to be mindful to the patient concerns and well-being. Cancer patients were offered oncology massage therapy during or after acute treatment and including in the advanced cancer stage. The study was funded by the Sydney Breast Cancer Foundation. Pre- and post-patient reported outcome measures were collected and therapies were conducted in the Integrative Oncology Living Room outpatient unit. A combination of oncology massage training techniques and protocols, manual lymphatic drainage, Bowen therapy and handheld laser therapy was used, and each session was around 45 to 60 minutes in length. The therapist had a minimum of 20 years in working with cancer patients and had received specialised study in this area. Patient-reported outcome measures, PROMs, were twofold. The ESAS-17 gathered before treatment to get a baseline, and the MyCore, both pre- and post-treatment session. This is the ESAS results of prevalence and range of symptoms pre-therapy, broken down into clinically significant, symptomatic and non-symptomatic for around 228 patients with the average age of 55. The cohort was all female, and around 3/4 had hormone-positive cancer, HER2 negative, about 20% triple positive, and around 6% triple negative. On the initial pre-therapy ESAS, the most prevalent symptoms of clinical significance were sleep disturbance, reduced feeling of well-being, and fatigue. Most women experiences are symptomatic, the sleep disturbances, the pain, and the fatigue. These are the MyCore results, the prevalence of concerns pre- and post-therapy compared in 215 patients on 449 occasions of service. Only concerns which were reported by more than 5% patients, both pre-massage, are included in the graph. The symptoms were categorised into 4 main areas: psychological and emotional, physical, cancer treatment and well-being. You can see from the chart that aches and pains are by far and away the strongest presentation. That's followed by cancer treatment concerns around lymphedema and swelling, stiffness, impaired range of movement, scar and cording. The MyCore, the Measure Your Concerns and Well-being, was given pre and post each session. Patients were asked to put down their major concern and rate them 0 to 6. And their well-being, 0 to 6. 0 is as good as it can be, and 6 is as bad as it can be. Here we have the comparison and the findings that show there was a significant improvement after massage therapy for patients' nominated concerns and their well-being. This retrospective audit of 228 women receiving oncology massage with a diagnosis of breast cancer showed the perceived benefit of massage as per pre- and post-MyCore response. The integration of PROMs as part of the integrative service enable real-time understanding of the patient's symptom burden, the ESAS, and the patient's 2 key concerns when seeking oncology massage. Oncology Massage is evidence-based, personalised care responding to the patient key concerns at the time. The most prevalent symptoms and most severe symptoms experienced by these women at baseline were similar to that expressed in the literature. This informs development of practice care programs to improve wellbeing for this cohort. Oncology Massage resulted in a statistically significant improvement of patient wellbeing and improvement in two key concerns of the patient at the time of the therapy. The results of this study are important for understanding the contribution of massage to reducing symptom burden and improving the wellbeing of women during and after breast cancer treatment. There were some limitations. There was no control. It was a retrospective evaluation, and timing with disease-modifying therapy was not recorded.